Medigroup Physician Services presents Medigroup's Frank's Fast Five with Healthcare Executives, produced by Bridget Wilson and Carrie Peters. Today's guest is Joe Gellatly, CEO for Medcurity. Now here's your host, Medigroup's Frank Gillespie.
And welcome to another edition of Medigroup's Frank's Fast Five. Today I have the privilege of sharing in some conversation with Joe Gellatly, CEO for Medcurity. Allow me, ladies and gentlemen, to share Medcurity's vision from their website, bending the curve on national healthcare breaches by helping healthcare organizations nationwide confidently navigate HIPAA compliance and security risk management. Again, that's one of their core visions within Medcurity. One of the reasons we reached out to contract with them. So they are a contracted supplier with Medigroup, and we are pleased to be here today with Joe. Joe, it's an honor and welcome. How are you?
Thank you so much, Frank, for the opportunity. We love the partnership and what you're doing. So I'm doing great and excited to talk with you.
Awesome. Thank you so much. Really appreciate the time. It's good to see you. So, Joe, I promised you I wouldn't waste your time. I'll jump right into this. Can you tell us a little bit about your background in the HIPAA compliant vendor management industry and your overall role at Medcurity?
Absolutely. So the healthcare market has been my home for the last 20 years or so. I've been serving hospitals and clinics and community health centers and all types of entities in the healthcare space. And mostly my role has been in technical. And before we started Medcurity, so about 8 or 9 years ago, we did a lot of what we do now, but we did it on spreadsheets. I was just an independent consultant, and we just tried to do our best to help these clinics and hospitals manage their HIPAA compliance. And so we had enough customers, enough healthcare leaders, providers, executives say, this is a really challenging part of the business. We're focused all day on taking care of the providers, seeing the patients, taking care of the bills. But in the night, you wake up thinking about what happens if we get breached. And it was a concern that came up and a challenge that came up frequently.
Absolutely. And you guys have grown to meet the challenge. And looking at your website and in our discussions with the contract, you do all sorts of things. And really that leads us into the next question. Can you elaborate a bit more related to Medcurity's various products and the various segments you specialize in, such as vendor management, network security, HIPAA training, all of those things? What else?
Absolutely. So I would say you can put all that under the objective of limiting breaches. We want to have less breaches in the healthcare space. It's happening way too frequently. We're under attack, right? Those healthcare breaches, the ransomware attacks, the different areas of attacks that are happening against our clinics, as well as other kinds of breaches like employee snooping or simply a lost laptop. Those can be so destructive. They can hurt the reputation of the organization. They're financially impactful, of course, very serious. So we focus in on the security risk analysis. So the security risk analysis is a required step, a required project that has to occur under HIPAA. So if you're providing healthcare, we've got to do this SRA on a regular basis. And that was, when I referred to earlier, it's a place of confusion. That's an area where we have this compliance requirement to do it.
Yes.
But let's do it well, but also let's use it in a practical sense. Let's do our SRA in a way that we're actually looking at our clinic operations and saying, hey, what is our risk? Where could we get breached? And how do we limit that? So we built a platform to help do the SRA in a very practical way. Get it done, be audit ready. Also, really clearly tell you, here's the places you might get breached. Here's our weak spots. And even in a small practice with very limited budget, here's the few things we can do to lower our risk that we're going to have to go through that experience.
Absolutely. And how often do you have to do that SRA? I mean, you do an initial one, then do you have like quarterly, annually? How often do you have to do that?
So the general best practice is annual. It's a great question, Frank. There's programs like CMS has a program called MIPS or Merit-Based Incentive Payment System. Mm-hmm. And that requires an annual attestation that you completed your security risk analysis. Okay. So that's the general best practices once a year. So we work as an annual subscription. We'll help our clinics complete that SRA, and then they keep that software all year. What we saw in the past is that you'd get a big report from an auditor, right? You just get 120 pages of an SRA and it'd go in the drawer, and you do it again in a year. And so we built that into a platform that allows those clinics to continue to work on those items through the year and show that progress and make improvements through it.
No, you've thought about the whole thing. That's awesome. So, Joe, then what is a major pain point? As you know, Medigroup kind of not kind of, we do focus on the non-acute care space. I mean, they're all important, certainly, but what's a major pain point perhaps in the non-acute healthcare space related to HIPAA compliance, and how does Medcurity work to solve that?
I would put this is probably for everyone, but I would put a major pain point as understanding how HIPAA and best practices in cybersecurity relate to a practice. You could read into what a large healthcare system needs to do, and that budget just doesn't make sense for an independently owned practice, for a community health center, right? So right sizing those requirements, you have to follow HIPAA, but do you have to buy massive monitoring systems, and do you have to invest in the kinds of technology that a large health system would? So we've really focused on helping right size that. So first off, with the platform, recommendations are matched to the organization. When we talk to a clinic, we talk through the types of steps they should be taking at their size. Like how do you just walk into these regulations without going and purchasing big systems? So for example, there's a lot of policy requirements, and we have that policy language right in Medcurity. So if you're missing some of the language that's required under HIPAA, you can answer a few questions and it creates a policy that's ready to go for you, and helping you understand how to do auditing in a way that's reasonable, that meets requirements, but again, isn't investing in a big system. So that's been a big piece for us. Is if it's too intimidating, then it's tempting to just not even look over there. We've got enough things going on. That's a whole, but there are enough steps that a practice can take in a financially conservative way to come into compliance, to stay in compliance, and to greatly reduce their risk of breaches or attacks, et cetera. So that's where we focus is let's be financially conservative, but get the things done that have to be done. Absolutely. And save that practice from disruption.
So you kind of start at that foundation level and kind of see where they're at, what they need, and then kind of build it up from there based on what is actually required and then what's nice to have, et cetera, until you've got the whole model built for them. Is that correct?
Absolutely. Yes. We say that our mission is that we build clarity and confidence in the security and privacy programs, because clarity's first. Just where are we today? Right. What are we missing? Where are we? We might even be over investing in certain areas, but where are we today? And then we build that confidence by taking the steps necessary to truly protect our practice.
A partner throughout the whole process. I love it. So, Joe, looking towards the future, what are some new or coming trends you're seeing from Medcurity?
Well, this answer is probably threaded through a lot of these conversations you have, Frank, and that would be looking at artificial intelligence and its impact on our world. And much like, ambient technologies, other types of tools that will help the providers with the clinicians with their documentation, there's also a lot to gain in artificial intelligence. So we look at both sides. The threats are changing. And something that might resonate with everybody is the phishing emails are getting so much better, right? We see that the quality of that content is getting so much more deceptive and well written, and we're seeing the impact that having these AI tools available to the bad actors is already having on us. So we have to make sure that our defensive tools are keeping up, that we're using AI in a productive way to help defend the healthcare system, right? So we're already building that into Medcurity. We're using some of those tools to help make this process as efficient and as accurate as possible for our practices. So watching the impact of AI on how we practice medicine and how we defend medicine is by far the biggest constant conversation we're having across conferences, customers, and Absolutely. Internally here at Medcurity. How do we stay ahead of this? And how do we leverage this?
Absolutely. I mean, you do have to be mindful these days. I mean, as you all know, the audience knows. I mean, I don't even open stuff in my emails anymore. If I see an email from my bank, it's like, I'll go to the bank's website. I don't click on the link anymore. It's just it's too risky. So all of those things are even more magnified in the healthcare world because there's more sensitive data, or a lot of sensitive data, I should say, personal data. All right, Joe, you've done great. Thank you so much. Last question. Are there any special hobbies you might like to share? What do you do for fun, Joe?
I love to get in an occasional poker game just to, do something that's mentally consuming, challenging, and strategy and luck and all of that. And then embarrass my kids with some karaoke at home. They love doing. They love singing. So those would be a couple things that that we take time to do. Yep.
Yeah, it sounds like a happy family. I love it. That's great. That is great. Joe, I've enjoyed it. It's been fun. You're great to work with. You have a great and valuable service. We're happy to be contracted with you. Thank you for all you do. Thank you for making time for this today. And I hope you have a great rest of the week.
Thank you, Frank. We appreciate you so much. Thanks for the opportunity.
I really appreciate it. Take care.
This has been MediGroup's Frank's Fast Five with Healthcare Executives, produced by Bridget Wilson and Carrie Peters, and hosted by Frank Gillespie. Special thanks to Joe Gellatly, CEO for Medcurity. This has been a presentation of MediGroup Physician Services.